Case example part 1. Mary is a program director and supervisor in a substance use counseling agency for adults. She has a master's degree in counseling, is licensed as a chemical dependency counselor, has 10 years of counseling experience with clients who use substances, including 2 years as a clinical supervisor, and has no personal history of recovery or formal training as a supervisor. In fact, she was promoted to the role of supervisor based on her performance as a counselor within her agency. She carries a caseload of 20 clients and typically supervises 7 substance use counselors at any time. Jack, a supervisee of Mary's for 3 months, is an intern in his second year of a graduate counseling program. He has 2 years of experience volunteering in the substance use disorders field as a peer counselor and has met the requirement in his state to begin an internship to earn the required hours of supervised practice toward becoming a licensed substance use counselor. He is 25 years old with a history of chemical dependency and has been in recovery for 3 years. At the onset of supervision, Mary verbally addresses the expectations of the supervisory process and internship, including duties, policies, and licensure requirements. She provided Jack with a copy of the Code of Ethics from NADAC and the American Counseling Association, but provided nothing else in writing. During their first meeting, she ensured Jack was aware of the agency policies and procedures by giving him an agency manual and shared with him her approach to supervision. She agreed to meet with Jack weekly and does so consistently. During their initial meetings, they discussed documentation requirements, counseling skills and challenges, and overall performance expectations. Although self-disclosure of recovery processes is somewhat common among the agency's counselors and the field in general, Mary learns that Jack's colleagues have observed him using self-disclosure inappropriately during co-led group counseling sessions and informal interactions with clients. Jack's colleagues have also reported their concerns to Mary, relaying that they believe Jack makes his own recovery the focus of his sessions and seems intimate and informal with clients, even meeting a female client whom he knows from a community 12-step group for dinner. As a result, during supervision, Mary confronted Jack with this information, discussing the importance of maintaining appropriate boundaries and relationships with clients. She also informed Jack that he needs to engage in self-disclosure more intentionally and with a predetermined clinical purpose. Over several meetings, she has worked with Jack on alternative techniques he can use to build a therapeutic relationship with clients so he is less reliant on self-disclosure. They have even role-played how to self-disclose appropriately. Despite these efforts, the complaints from others persist. Mary has grown frustrated and confused regarding how to ensure Jack provides services in a competent and ethical manner, yet she is afraid of any negative consequences she may face should she move to confront Jack further or even dismiss him from supervision. In their meetings, Jack denies the reports from peers, stating he acts appropriately at all times. Mary does little else regarding the matter, especially because she receives fewer reports from others about Jack's performance and tells herself that she has little actual proof that Jack has pursued any inappropriate relationship with a female client. Jack also denies ever receiving a copy of the Code of Ethics or any other information from Mary, further frustrating Mary. She ultimately chooses to simply continue supervision with Jack with no further action.